about it through the grapevine, actually. Someone who knew someone who knew someone who knew me had found out that I had just graduated with my master's degree in physical therapy from the University of Indianapolis and focusing on manual therapy techniques. And they came to me and were looking for someone to help start the first Graston technique clinic and to help start their educational program.
Well, actually, I was traveling on the PGA Tour as one of their physical therapists, athletic trainers, and we had one of our golfers tear part of his flexor tendon in his elbow. And so I was doing traditional treatment, manual treatment, friction massage, modalities, exercise strengthening, and he just wasn't getting better. Our medical director, Dr. Frank Jobe, wanted to do surgery on his elbow, but he didn't really feel it was a surgical condition and didn't want to take the rest of the year off to have surgery, so he started looking into alternative treatments. And he heard about these guys in Indianapolis doing soft tissue work with metal instruments. To make it even more of an interesting situation, this golfer was a pilot, had his own airplane. What he was doing twice a week after his round, he would fly himself to Indianapolis, get his elbow treated, and then fly back to the tournament. And his elbow started getting better. And I was just intrigued, what are these guys doing with metal instruments that I can't do with my hands? How are they getting better outcomes than my manual treatment? And I was just amazed how the instruments would amplify abnormal tissue texture and allow you to just to specifically feel the fibrotic restrictions that you just can't pick up with your hands.
It was actually at an NATA convention. I saw that I'm exhibiting, and I kept going up to the booth saying, what is this? Give me a little bit more information. And when they started working on my thenar eminence, and I felt how crunchy that was, and they explained it all to me, I went back, told my administrators that we ought to look into this because we could be the first one in our area to do it.
My first job was at Indiana University, and that's kind of a big area with Graston. John Schrader's an instructor down there in the graduate program, and that was something that my boss, when I came in there, wanted me to learn. So I went and took the course with John and became certified in Graston.
I actually was a patient of Graston Technique before I was a clinician for Graston Technique. I did a lot of soft tissue work, specifically like ART, and a lot of cross-friction work, and I actually developed a medial epicondylitis that quickly went into more of a chronic epicondylosis issue, and a colleague of mine had started doing Graston Technique, and I'd seen it a couple years before it was really being taught, and before there was actually like an actual class for the course. And so I had him work on me, and it was the first time I hadn't had pain in my elbow in like 3 months. And I was able to go to work the next week and not have pain, and I said, I've got to do this. And so within 3 months, I was trained in Graston Technique.
I was first introduced to Graston Technique in 1994 by Mark Fowl. He was a head athletic trainer for the Milwaukee Bucks at the time. And during that time, they were practicing at Loyola Marymount University. And he came into my training room. I got to know him. And he introduced the tools to me at that time and said how great it was and the results he got from using these tools. So I've been knowing about Graston for a long time. And now I have the ability to use them and then use them with our athletes and be very successful with them.